But we all know that being a student can be stressful sometimes. In fact, emergency rooms are overwhelmed with children showing up for mental health conditions, including depression, anxiety, even suicidal thoughts.
And doctors need help. Now, 3 medical associations are calling for changes. Let's turn to the president of the Florida chapter of the American Academy of Pediatrics, Dr. Thresia Gambon. Dr. Gambon, thanks so much for being with us tonight. Now, it seems very difficult these days to just even get an appointment with a psychiatrist or a therapist, so parents feel as though they have no other choice but just to go straight to the ER to get the kids the help that they need. Where else could they go? Is the ER not the right choice for their first stop?
Well, I would encourage the patients, the families, to come to the pediatric clinics. They should be seen by their regular providers because we are the ones who know the families and we know the kids. We're also the ones who know the resources that are available. So if they come in and they can see us and they can speak with us and share their concerns and not wait until the child is in a crisis or doing very poorly, that would be the best thing. The earlier that they can get in with us, we can discuss it with them and help hook them up with resources. Several pediatric offices have behavioral health available on site, social workers, psychologists, or other providers to assist. So I would suggest that the first stop should be with the routine regular doctor.
Dr. Gambon, pediatric mental health can be complex and children tend to stay in the hospital longer, 17 hours versus 5 hours on average for ER cases. Now, this can exacerbate the situation for kids and possibly make things even worse for them, right?
Well, I think there's different reasons they might be staying in the ER longer. Children sometimes present with somatic complaints, so they might be coming in with abdominal pain, vomiting, headaches. So they always have to be evaluated to see and determine if there's a medical cause for some of these symptoms. So that could also make the stays a little longer. The other reason, I'm unsure if all those patients are getting admitted or some of them are getting admitted, there is a backlog and a lack of beds and resources available. So that might lead to a longer stay in the ER until there is somewhere available for them to be admitted to.
And we're hearing about these shortages of psychiatrists and psychologists and other mental health professionals. Why is that? Is it just because there's now too many patients for the group of physicians that are already in practice to handle that?
Well, physicians shortages, healthcare worker shortages have been discussed for quite a while now, even pre-COVID, but during COVID it got worse. So there's a lot more shortages. We have a bigger population than we had before. And with everything that's going on that we see on the news and all the different crises that are happening, and including the pandemic, there's a lot more people getting diagnosed with mental health problems. So there is more need. So even though there was a shortage before, the shortage is even worse now because there's more need. And then we also have a large population of physicians that are in the retirement age that are leaving now. So there is a big gap. I know it's being looked at our state level and national levels to expand training programs. That's going to take a couple of years. So we have to look at collaborative models between primary care providers, different mental health workers, and see what we can do to best get this help to the kids and the families.
Yeah, and of course there's always that stigma that's been associated with just looking for help, and we need to find ways to get over that. But Dr. Gambon, we're out of time. Thank you very much for joining us tonight.
Okay, thank you so much for discussing this.
All right. Thank you.